Okay, now I am back. I'll move that a little bit more like that. Okay, now I am coming back to the patient's room. I'm going to recheck the MAR, the MAR, at this time. Outside the patient's room, double check that the meds are correct, make sure this is going to the right patient. Outside the room, I will knock to enter the room, just so I don't startle the patient so they know I'm coming. Go ahead and do some hand hygiene. And I will enter the room with the patient's medications. Okay. Now, as I hand the patient each medication, I'll go ahead and start with the ones that are oral intake. The patient, I'll go ahead and put my gloves on as well here. But the patient, I want to check their gag reflex. Want to make sure that they're not going to aspirate this medication. Make sure they're not going to have any difficulty swallowing the medication. So, sir, Matthias Johnson?
Yes.
Okay. What was your birthday again?
11/29/50.
Okay, excellent. So, we're giving you 6 medications, and that's normally how many you take?
Yes.
And 2 of them in your pudding, and the rest through all different means?
Yes.
Okay, have you had any trouble swallowing lately?
Yes.
You've had some trouble swallowing, okay. Do you think you can swallow right now?
Yeah, I think so.
Okay, with the pudding, okay. I'm going to go ahead and have you cough for me. Can you cough? Now listen into the lung sounds here. I'm hearing the pneumonia. I'm hearing a little bit of bronchi from the pneumonia. Probably from the pneumonia. It's possible that this patient is having a little trouble swallowing. Could you swallow for me? Okay. Swallow looked okay. It looked like I've seen some movement. I'm going to go ahead and check the patient's gag reflex. Let me go ahead and take a look in your mouth. Have a tongue depressor here. I don't really, but I'm looking back there. Kind of stick it in there, do you? Let's pretend the patient gagged from that tongue depressor. Then I'd say, okay, well, thanks for letting me see in your mouth. And then I'd know the patient had a gag reflex. So let's go ahead and first give you your medication here. This is your pudding, and it has your Practipred, and it has your Practidoxy. And there you go. Okay. I visualize the patient putting all of the medicine into their mouth. And can you open your mouth real quick again? Okay, look in there. I'm not seeing any medication in their mouth still. It looks like they did manage to swallow it all. So that's a good thing. So we finished with the oral medications. And while the patient's still upright here, I'm going to go ahead and give the liquid medication. This is the Robitussin. I'd want to assess for the same things before a liquid medication, as far as them being able to swallow, make sure they're not aspirating it, and then, okay, the patient was able to consume all of the Robitussin. Oh, shoot. Yeah, that's PRN. Okay, that's right. All of these, I was just double checking, because I didn't see the 0800 on that one, but all of these were to be given at 0800, and then PRN we were also going to be giving, and for this example, but PRN means as needed. So if the patient was having a cough, then I'd give the patient some of that. If they said they didn't have a cough, they didn't need the med, then I wouldn't need to because it's not as needed. Okay. So, let's go ahead and do the nasal with the patient still sitting in their upright position where they were before. I didn't really raise this bedside because I haven't had a need to, but I could raise it now if it... Now let's go ahead and... I don't want to put them into Fowler's. We want them in semi-Fowler's, which is pretty much where Mr. Johnson here is. So, have you used this before?
Yes.
Okay, and how do you use it?
I just sniff it up my nose.
Okay, do you breathe it in deep into your lungs, or just do a quick sniff into your nose?
Quick sniff in my nose.
Okay, good. Then I just had to check before I gave it to you. And so for this medication, it says 1 squirt to each nair. So I'm going to go ahead and have you squirt 1 squirt into each side of your nose here with that. Okay. The patient was able to self-administer, showed capacity to do it, did it correctly, and so that was good. Just had to assess the patient's ability to do that, make sure that if you're going to have them administer it themselves, which some meds they may, that they're doing it correctly. Okay, and then have you taken this albuterol inhaler before?
Yes, yes.
Okay. Do you normally use the extender?
No.
Okay, you don't use the extender. Okay, good. Well, here's your med. Go ahead and so you know how to do it. Could you describe to me how to take this med?
I put the mouthpiece in my mouth and spray it, and then I inhale and hold it in my mouth for like 10 seconds, and then I slowly exhale.
Okay, inhale deeply, right?
Yes.
Okay, well I'm going to give this to you and let you take, it says here that we would like, just double checking this, we'd like for you to take 2 puffs of this medication. So I'll go ahead and let you do that. Okay, how's your breathing feeling?
Feels better now with that.
Okay, I'm going to go ahead and listen to your lung sounds real quick. Okay, yeah, didn't notice a huge change in the lung sounds. Maybe a little less rhonchi, but it wasn't super noticeable, but the patient feels better, and so that means that it's probably being effective. And okay, so we've taken the nasal allergy, the Robitussin, albuterol, the Praxidoxy, the Pred. So all we have left is the eye medication. So I'm going to go ahead and... Have you had the eye medication put in before?
Yes.
Okay.
But you could do it.
Okay. Well, I think it's better if I do for this particular medication. Go ahead and lower the bed. For the eye med, I suppose I don't have to lower the bed, but I decided that I wanted to. Do you prefer the bed up or down, sir?
It's fine.
It's fine. Okay. I'm going to go ahead and... I'm not going to do this to my current sample patient. I'll pull the conjunctiva down, or pull the lower eyelid down so that I reveal the conjunctiva, and then I will go from inner canthus to outer canthus. If the eye had any eye gunk, anything going on with it, I'd examine the outer eyes. If it had any eye gunk or anything like that, I'd clean it with a clean washcloth. If they both did, I'd clean them both with a clean washcloth, but make sure to use a different surface for each eye. I'd make certain not to touch this against the conjunctiva or canthus in any place. This is a cream, so I'm not worried so much about it running out, but if it might, I put pressure on the nasal lacrimal sac to prevent it from running out. Other than that, I'd put a ribbon, it says 1/2 inch ribbon, going for the inner canthus, towards the outer canthus, and the same thing on the other side, inner canthus towards the outer canthus. After I put it on, I would massage the patient's eyeballs. Well, that sounds funny. Have the patient close their eyes, and I could massage the medication gently to distribute it within their eye lids, within their eye. So, having done all of that, I would, having checked all the meds 3 times, having done the 6 rites, having given each of my meds to my patient, now I'm finished. I would tell the patient that the procedure is finished. Procedure, I finished giving you your meds, okay, Mr. Johnson?
Okay.
Is there anything else you need?
No.
You look like you would like a nap.
Yes.
Okay, well, I'll go ahead and let the patient take their nap so long as it's not contraindicated. And I would document any findings, as well as document that I have given all of these meds on the MAR. If there's any meds that I hadn't given, I would document that as well. If for any reason the patient couldn't tolerate a medication or refused a medication, I'd always document that. I would return the bed to the lowest position and make sure these guardrails are up. I would discard any trash, and I'd clean up my area. Anything that I needed to return to another area, I would anything we were using, I'd clean, and I would put away. And for this stuff, that's all this stuff. And anything that was disposable, I would throw away. I'd perform hand hygiene on my way out.